Hello, this is Dr. Ron Valdesari, Deputy Assistant Secretary for Health in the Department of Health and Human Services, and we're talking to you today from the International AIDS meeting in Austria, where I am joined by my friend and colleague, Dr. John Brooks, who is an infectious disease specialist at the Centers for Disease Control and Prevention in the U.S. in the Division of HIV/AIDS Prevention. And thank you for joining us, John.
It's a pleasure.
John, I know that you were able to present some very important public health information about influenza and people living with HIV/AIDS. I wonder if you could tell the audience what you found basically and what results you shared with the scientific delegates here at the meeting.
Thanks, Ron. It's really great to be able to join you here today and share some of the information that we shared with the greater audience here in Vienna at this really exciting conference. We did an analysis of data collected by the CDC asking the question, how well are people with HIV infection being vaccinated against the flu? We did this from a large data set. It's called the HIV Outpatient Study. It's a study that CDC maintains following HIV-infected Americans in their routine care. And we wanted to ask the question, what fraction of persons are vaccinated every year? As you're probably aware, the national target is that 60% of Americans be vaccinated, including HIV-infected Americans, against flu every year. What we found in this analysis was that somewhere between 30 and 40%, or on average only 35% of persons living with HIV in this cohort study had been vaccinated for flu between the years of 1999 to 2008. Now that's important because we didn't include 2009 this past year when there was the pandemic, and we expect that rates will go up, and we'll go back and look at the data shortly to see if that's the case.
So just to make a point to clarify for the audience, the 60% is a target, but John, we want to make sure that everyone understands that everyone who has HIV, unless they're allergic, have an allergy to the flu shot, everyone is recommended to get the seasonal flu vaccine every year.
Ron, that's a really important point to make. We have a target of 60%, but we recommend that all persons with HIV infection, regardless, incidentally, of their CD4 cell count, be vaccinated. Some people still believe that persons who have low CD4 cell counts in particular may not respond to vaccination as well as persons with higher CD4 cell counts. But in the current opportunistic infection prevention and treatment guidelines published by CDC in collaboration with the HIV Medical Association and the IDSA, we recommend that all persons, regardless of their CD4 cell count, be vaccinated.
Great.
Now, the only contraindication to vaccination would be an egg allergy or a prior bad side effect from vaccination, which is very rare. Right. We know that vaccination is very safe for persons with HIV infection. Some have been concerned that any stimulation of the immune system, like with a vaccine, could temporarily raise the viral load and suppress the CD4 cell count. But in fact, when we've looked at this, to the extent that that effect ever occurs, it's very temporary and it goes away.
So it's the take-home message. People living with HIV should get their seasonal flu vaccine every year. It's safe. Now, John, where can the viewers go if they want to find out more about HIV/AIDS and in particular flu vaccine?
Sure. www.cdc.gov is a great place to go for information for both of these topics. People who are interested can search on the website. There's both a lot of information about HIV/AIDS on our website, but there's also specific information about HIV and flu, both for patients and for providers.
Excellent. And let me just end our time together, John, by saying that hopefully many of you watching this are aware of the fact that last week the President and Secretary Sebelius released the National HIV/AIDS Strategy in the United States. One of the three major goals of that strategy is to improve care for people who are living with HIV/AIDS. And that doesn't just mean getting diagnosed in a timely manner and getting antiretroviral treatment. It also means getting necessary vaccinations like seasonal flu. Yeah. So this is really important information you're sharing with the audience, and I thank you, John. And signing off from Vienna, Ron Valdesari and John Brooks.
Take care, everybody.